Hello friends, welcome back to Complete Medical Coding. Today let's discuss some coding, how to code acute and chronic conditions. Okay, coding acute versus chronic. How to code acute conditions and how to code chronic conditions. Okay friends, so let's look into the video, the slides one by one. What are acute conditions? Or what do you mean by acute conditions? Acute conditions arise suddenly, short duration, severe, but treatable. Okay, so acute conditions are like it will arise immediately, it will arise suddenly, as you already know. Short duration, it will be severe, but it is treatable. These are some examples like pneumonia, heart attack, sprained ankle. All these are examples for acute conditions. These are just common some examples. Okay, fever, cough, cold, everything is acute. Now, what is chronic conditions? What do you mean by chronic conditions? Chronic conditions develop over a long period. It will persist for months or years. It is manageable but require ongoing treatment. So, chronic conditions, it will not develop suddenly. It will be developed over a long period of time, like months or years. It can be months or it can be years. It's a manageable. Chronic conditions are also manageable, but it requires proper treatment, proper ongoing treatment, continuous treatment. Okay. So these are the examples: DM, diabetes, hypertension, osteoarthritis. All these are chronic conditions, but it requires continuous treatment. Okay. Now let's see how to code. What are the coding guidelines for acute versus chronic conditions? How to code acute and chronic conditions. Okay. Using ACUTE codes, how to code acute conditions and how to code chronic conditions. So, using ICD-10 codes, acute conditions are coded with acute disease codes. In the ICD-10 manual, you can use the acute disease codes, whereas chronic conditions coded under chronic disease codes with additional codes for associated complications. So, you have to always go for the, in case of chronic conditions, you have to always choose the chronic diagnosis along with the, if there is any associated complications, you have to always code for the complications as well. Okay, like for example, chronic systemic disease, then along with heart failure, or along with what can we say, pneumonia. Okay, for example, a patient is having pneumonia and they have something like fever or some other diagnosis along with that, or some complications, severe headache, whatever it is. All that has to be coded. Pneumonia is not chronic. Pneumonia is acute only. For chronic, if you can take same DM, you need to code DM along with if there is any other complications for the patient. I mean, if any other complication associated along with this DM, you have to code that also. Okay. Now, coding scenarios. Acute conditions. Code acute disease codes for conditions like pneumonia. And for chronic conditions, code chronic disease codes for conditions like DM with additional codes for complications, as I told you. Now, acute exacerbations. What is acute exacerbations? Code both. Acute exacerbation means you have to code both chronic and acute exacerbation. For example, COPD exacerbation. Okay. Now, let's see the sequencing guidelines. Acute conditions take precedence. So, what are the sequencing guidelines? Which conditions to be coded first, whether it is acute or chronic? Okay, that's what we are going to discuss here. So, here acute conditions take precedence. Code acute conditions first, especially when a patient presents for treatment of the acute condition. So, if a patient is in the hospital, in the physician's room to treat some acute condition, you have to code the acute condition first. Then you have to code some history. If there is any history of whatever it is, of DM or something, whatever the patient is having, that you have to code it separately as a secondary diagnosis. But if the patient is here to treat an acute condition, you have to always code the acute condition first. Okay. Now, chronic conditions as primary focus. When will we code chronic conditions as the primary? List chronic conditions as the primary diagnosis when they are the primary focus of treatment. For example, routine follow-up visit for diabetes management. Yes. So when will we code chronic as the primary diagnosis? Whenever the chronic conditions is the primary focus of the treatment. Like for example, the patient is here as a routine visit for his DM. Then for his diabetes checkup, the routine follow-up visit for DM or hypertension or whatever it is, then you have to code that as the primary diagnosis. Along with, if any other condition the patient is having, you can code that also. Now, exacerbations and complications. When should we code exacerbation and complication as the primary? Code exacerbations and the complications according to whether they are acute and require immediate attention. So, whichever needs immediate attention has to be coded first. Okay, for in case of complications, whichever treatment requires an immediate attention. For example, a burn case, it requires an immediate attention, right? So, in such cases, you have to code that as the primary diagnosis. Now, let's see an example. Diabetes with acute complication. A patient with DM presents with diabetic ketoacidosis. Here, diabetes is coded as the chronic condition, but diabetic ketoacidosis, which is an acute complication, is listed first. So here, what is the diagnosis? The patient is diabetic, but with acute complication. So the patient, since the patient is already a diabetic patient, but the patient is here to treat, the patient is having some acute complication. It's an acute, but it's a complication. So the patient with DM presents with diabetic ketoacidosis. So it means diabetes is coded here as the chronic condition, but the ketoacidosis, since it is a complication, that has to be coded first. Okay, so ketoacidosis has to be the primary along with DM as a secondary. But in case if there is a combination code, use that combination code always as the primary. Okay. Now, coding and sequencing for chronic conditions. Use of Z codes. Chronic conditions, how do we code? How to code Z codes? Z codes are usually encounter codes, right? So, encounter codes, Z codes are the encounter codes used to indicate ongoing care for chronic conditions. So, like for example, Z79.4, it's a long-term use of insulin in patients with diabetes. Z51.81, chemotherapy or radiation therapy. So, Z codes are the encounter codes which are used for the ongoing care, the continuous treatment, the continuing treatment for chronic conditions. So, in such cases, you have to code Z code. Like this examples, chemotherapy, radiation therapy, long-term use of insulin, all these are Z codes. Now, coding scenarios. Chronic condition alone. When do we use the chronic condition alone? Code chronic condition with a Z code when stable and not actively treated. So, you have to always use the chronic condition alone. Only when a Z code, code the chronic condition with a Z code when stable and not actively treated. When the patient is not, when the treatment is not actively done, when it is not actively treated, when it's a stable condition, then you have to code the Z code, the chronic condition alone, the only Z code. Okay. Now, chronic condition with ongoing care. So, it means continuous treatment. Use Z codes in conjunction with chronic disease codes for encounters for ongoing care. If there is a continuous treatment going on for the patient, then you have to code Z codes along with the chronic, whatever the chronic condition the patient is having. Okay. So, that's how you have to code the chronic conditions. Hope you understood, and I'll be coming back with some examples and questions, practice questions for coding acute and chronic diseases. Okay, friends. So that's all for today, and stay tuned for more videos. If you are new to the channel, please subscribe. And if you like this video, if you find this video useful, please like and share it among your friends. Please support me by subscribing to the channel. Thank you so much for all your support. So stay tuned, friends. Bye. Take care. See you soon.